And now it's time for Are You Smarter Than a Virus? With your host, Infection Preventionist here at Edgerton Hospital and Health Services, KaeLee Dahl.
All right, I'm your host, KaeLee Dahl. Welcome to Are You Smarter Than a Virus? Today's contestants, we have Brooke Eckelberg and Jason Hafeman. All right, you two, are we ready to get this challenge on? Your first question. Is the flu vaccine the same every year? Jason, for 100 points.
Yes.
Incorrect.
Oh.
The flu vaccine is actually formulated differently every year to reflect the predictions of what the flu strains are going to be for the upcoming year. Good try. Good try.
Okay.
Moving along. For 200 points. Will a vaccine give you the disease? Brooke, you got it.
That's false.
Correct. No, the vaccine will not give you the disease. However, when you do receive a vaccine, sometimes our immune system likes to respond to that vaccine. And what it's doing is it's building up our immune system to react to any sort of exposure to the virus. Very good. 200 points to you. Jason, you're at 0.
Okay.
Okay. For 300 points, if you live in an area with a high vaccination rate, do you need to vaccinate your child? Jason.
Always vaccinate your child. Yes.
Correct. Yes, we want to build up our herd immunity in the community. That means we want to be able to vaccinate everyone that is eligible and healthy so that we can protect those around us that are not. So our immunocompromised individuals that may be going through chemotherapy, our elderly, or our very young children who have not been able to be eligible for the vaccination. Very good. Our points so far is Brooke with 200 points and Jason, surprisingly, with 300 points. All right, moving along. You can only get vaccines if you have a primary care provider. Brooke.
That's false.
Very good. That is false. So there are many resources that are available out in the community for those who are underinsured or lack insurance. The best place to go is to your local health department who have programs in place for vaccines for adults, and there's also vaccines for children. Brooke, you have 600 points. Jason, you have 300. Our last question for the win is, you go to the emergency room after stepping on a rusty nail, but you had your tetanus shot 8 years ago. Are you up to date since the recommendation is every 10 years? Jason.
What if I didn't step on a rusty nail, but a rusty nail got lodged in my arm when I was in an attic?
Interesting scenario. Wrong. In fact, in cases of high concern such as a dirty wound or burn, it is best practice to receive an updated vaccine if it has been 5 or more years. And our winner is the amazing Brooke Eckelberg. Woo!
Thank you.
That was fun.
Thank you.
That was really fun.